Story 1. Obligatory, not a doctor. But I am an emergency room nurse. We had a guy come in with what he thought was bronchitis. He asked for the test just to calm his family down. His chest x-ray showed COVID pneumonia, and his test came back positive. First, it was, I'm going to need to know my test results before I believe it. Then it was, I need to see the test results because you can say anything. He refused admission and left against medical advice, and as if trying to say the most ridiculous thing he could think of, said, and I won't be telling my family because I just don't believe this. He returned 2 days later, oxygen saturation in the 70s. He spent about a week in the intensive care unit, intubated, before dying. Story 2. Not entirely related, but with visiting not allowed, we would make more of an effort to call families to update them. I was on a non-COVID ward and updating a family member of an elderly patient. They asked about COVID swab results. I used my best reassuring tone to let them know they had been negative so far and we were doing our best to keep it that way. His response was, negative? Well, how about that? And he went on a rant about how it was all a hoax. Story 3. Not a doctor, but an emergency medical technician. We got called for someone with difficulty breathing. Arrived on scene to find an 87-year-old female in tripod position, a bad sign with visibly labored respirations. Dispatch warned us of COVID-19 symptoms, so I was in full personal protective equipment. Gown, gloves, goggles, N95 respirator, and surgical mask. We assessed vitals and found her blood oxygen saturation was in the low 80s, a very bad sign, with respirations of 28 breaths per minute and bilateral rales and wheezing, also a very bad sign. As I was getting vitals, my partner was asking her some questions, while one of the trainees asked her daughter for a history. The patient spent the entire time yelling at us about how it's a hoax and told me to take my mask off. We refused, and I told her I needed the mask for my protection and that we actually needed her to put one on. She said, like hell, I'm putting one on. But she was too weak to fight us, so we put one on her anyway. She swore she did not have COVID-19, even though her daughter said she had a recent positive polymerase chain reaction test. In the ambulance, she tried to pull my mask off. I warned her that if she tried that again, I would restrain her. She then tried to explain to me that I'm a sheep and killing myself as she struggled to breathe on 15 liters per minute of oxygen via non-rebreather mask. Story 4. I work in dermatology, and although not intuitive, there are many skin manifestations of COVID-19. Some manifestations are relatively specific, others not so much. I had a patient in our outpatient clinic who presented with pernio, one of the more specific skin manifestations of COVID-19, who flat out refused to wear a mask to her appointment, refused to allow us to administer a COVID-19 swab, and proceeded to counsel me on how COVID-19 was a hoax. Given that we had a high suspicion of COVID-19, we shut down our clinic for the day, for the safety of our other patients. One of my nurses tested positive 3 days later, despite self-isolating, and we had to keep the clinic closed until all other workers had negative results. This took 10 days. Although this was costly to my practice, what bothered me the most was the inconvenience that it placed on all the other patients I was supposed to see that week. In fact, one of the patients who had to move their appointment was subsequently diagnosed with melanoma. It likely didn't change their disease course, but was still difficult to see. The nurse is healthy. She had a mild course. Also, it has been shown that patients with pernio often have a less severe course with COVID-19, which I'm sure only exacerbated this entire situation. Haven't seen the patient again. Story 5. ICU nurse here, 6 years. Dealt with COVID-19 since March 2020, actually had the first confirmed patient at our hospital. November to February was rough. I had a 2-week streak where every day 1 or 2 of my patients would die. We'd go up to 3 or 4 patient assignments. The norm is 2 to 1 or 1 to 1 if on certain equipment. Most of the patients understood the severity of what they had. A handful didn't believe they had COVID-19, even though removing high-flow oxygen or their bilevel positive airway pressure would put their oxygen saturation down into the 60s or 70s. Many had comorbidities that put them at risk, such as chronic obstructive pulmonary disease, asthma, obesity, sleep apnea, or smoking. I think people would refuse to be intubated because they knew what the outcome would be. Fight, hope, pray, fingers crossed, whatever you want to call it, delaying the inevitable. Our ICU attending physician would actually have them sign consent for intubation if they were cognizant enough to do so. Almost all of them died. Very few made it out alive, but still so sick and debilitated, some with tracheostomy. One guy in particular sticks out. This was right after Christmas. 21 years old, history of type 1 diabetes, obesity, sleep apnea, didn't like to take his insulin. Admitted with COVID-19. Didn't believe he had it. Should have been intubated days before but refused. Then he ended up being intubated emergently. Took about 5 of us to prone him, lay him on his stomach because his oxygen saturation were in the 60s. Couldn't get a pulse, noticed no waveform on the arterial line. Had to flip him back over to do CPR for about an hour or so before we called it. Had a kid and a fiancé. Honestly, it was more of the families that denied their loved one had COVID-19. Upset, understandably, about not being able to visit. Zoom calls just don't cut it. I say this all as my parents, mom and stepdad and dad and stepmom, are all COVID-19 deniers, even when I tell them what it's like. Well, those people had other things wrong with them, though. They were older, they tell me. They send me links about all the conspiracy theories regarding COVID-19. I got the Moderna vaccine in December and January, still haven't told them. It's awful. The facial swelling alone from being prone is enough to give a person nightmares. Watching someone go into multi-system organ failure, needing dialysis, unable to put them back onto their back, being maxed out on ventilator settings, and that's still not being enough to the point of barotrauma and collapsing a lung and needing a chest tube to reinflate it. Families saying do everything, even though they had coded once or twice. Hearing families on Zoom crying, praying, singing as the patient is intubated, sedated, and paralyzed so the ventilator can do the work. Tearing up under all the personal protective equipment because, yeah, we are still human. We work so hard and sometimes it doesn't even matter. But we go back day after day. I wish people who don't believe could see what I have seen. It might scare them enough to take precautions seriously and get the vaccine. Story 6. Intensive care unit and COVID-19 intensive care unit charge nurse here. Had a woman try leaving the emergency room against medical advice with COVID-19 and was needing tons of oxygen. Our doctors convinced her to get admitted. My wife was her emergency room nurse and brought her up to me. The patient was yelling and screaming, ripping off her mask, spitting, and telling us we're all sheep between gasping for breath. Our doctors told her she was close to needing to be intubated, which means a breathing tube, and she just scoffed. We reached out to the husband, who proceeded to swear and berate us, telling us we're keeping her prisoner, as there are no visitors in our COVID-19 unit, and that we can do whatever we need because none of this is real and it's all for show so you guys can get paid. She gets intubated, decompensates over the next few days, and finally codes. We perform cardiopulmonary resuscitation, give medications, and defibrillate her for well over 1.5 hours before calling her time of death. The kicker was calling her husband and getting absolutely excoriated because we injected her with COVID-19 as an experiment and killed her. He then had to be escorted out of the hospital when he came in to try getting up to the unit without a mask, of course. This is getting exhausting. Story 7. One story stands out. Last summer, a man came to the emergency department with symptoms and tested positive. He refused admission for the classic list of reasons. It's a complete hoax, and even if it's not a complete hoax, it's not that big a deal, I'm strong enough, etc. A couple of days later, he was back in the emergency department with his mother, who he lived with and who was now also symptomatic. They were both admitted and eventually put on ventilators. The man lived, but his mother did not. Story 8. Emergency room doctor here. I diagnose people with COVID-19 daily. Some people handle it really well, while others are more difficult. Let me tell you a story that occurred during my most recent shift, moving from room to room and patient to patient. Patient A in room number 4 is a 23-year-old male with no medical history, who came in with body aches, malaise, and fatigue. He also had some mild nausea without abdominal pain or vomiting. Patient B in room number 5 is a 51-year-old female with a medical history of intermittent asthma, so she uses an inhaler infrequently. She came in with shortness of breath and possibly had fevers at home. In triage, it was noted that this patient's oxygen saturation levels were in the 88 range, and her heart rate wasn't elevated. Interestingly, when asked if she thought she had COVID-19, she said, "I can't have it. I tested negative 2 weeks ago when my son tested positive. He's been sick at home." You guessed it, both people tested positive for COVID-19. Patient A went home. He's doing great. He was extremely remorseful, and before he even left the emergency department, he called his work to let them know he was positive and to get everyone there tested because he figured he had contracted the illness at work. If I recall correctly, he worked in a small family-owned warehouse as a foreman. He also called his parents, and they were setting him up to sleep in the garage until his quarantine was up. I respected this guy. Patient B was admitted to the hospital because her oxygen saturation levels weren't great. When I went back to tell her she was positive for COVID-19, she called me a liar and told me I must have made a mistake. She threatened to sign out against medical advice, but when she got up to leave, she became so short of breath that the nurse used that to convince her to stay. People are strange sometimes. I try not to let things bother me, but COVID-19 deniers come very close to crossing that line. Story 9. I'm an emergency room doctor. I had a patient a few months back who refused to wear a mask. I calmly explained to him that it is hospital policy during the pandemic for everyone to wear one to protect each other. He seemed to take it well, even though he kept insisting that the mask makes it impossible for him to breathe. At the same time, he tried to tell me how he knows all the science, and that masks actually cannot stop the virus from transmission. He then became very agitated, ripped his mask off, and started yelling about 2 inches from my face about how foolish I was for not knowing all the facts. He literally said, "I can't believe the hospital hires people like you to be a doctor. You need to toughen up. It's not that big of a deal." He then stormed off coughing. 2 things. 1. Millions of counted and probably at least 1 million uncounted dead across the world, to me, constitutes a big deal. Even if it doesn't kill you because you are young and healthy, it can still have serious effects. Strokes, heart attacks, blood clots, new-onset type 1 diabetes, bowel obstructions. I have seen it all, even in people who are super healthy and young. Get your vaccine when you are able. 2. You can't say that a mask makes it impossible for you to breathe and that it doesn't stop transmission. The virus particle is about 1,000 times larger than an oxygen molecule. You can't say that the mask magically blocks oxygen but lets the much larger virus pass through. That doesn't make sense. Story 10. Not a doctor but a respiratory therapist. We had a patient, a mother of 3, on FaceTime with her boyfriend, denying it was real right up to the moment we intubated her. Guess who ended up with a tracheostomy and percutaneous endoscopic gastrostomy and never came off a ventilator until she died? Story 11. I'm a registered nurse. I lost count of the number of patients I had who were COVID-19 deniers, even right up until their last breath. During the peak in January, an average shift had me spending an hour or 2 being cussed out by patient family members claiming COVID-19 was fake or that we couldn't keep them from seeing their family member. Then I'd spend the shift sweating like I was in Kuwait, running around trying to keep everyone as comfortable as possible and maintaining their oxygen levels, often repeatedly having to put someone's oxygen back on after they insisted they didn't need it. Multiple times I was told we had it all wrong, that it was just a cold, or that they weren't that sick and didn't need oxygen even as they ran out of breath trying to get out a single word. Being in a super conservative rural area, it was to be expected. We even had COVID-19 denying nurses for the longest time. Eventually, they got the picture, though, and got with the program. Still, one of the worst cases that stuck with me wasn't the COVID-19 denying patient. The patient believed in COVID-19 and was a great person. They were old, though, and had a caretaker. The caretaker didn't believe in COVID-19 and was strictly anti-mask. Upon the caretaker being diagnosed with it, they refused to wear a mask or quarantine and said it was fake. They continued taking care of the person and never informed them of the diagnosis. That person ended up getting COVID-19 and being admitted to us. Story 12. The patient themselves understood and agreed to all treatment. Their son, however, called us every single day to express anger about testing the patient. accusing us doctors of being influenced by the government and spreading lies sponsored by the Centers for Disease Control and Prevention. The Sun even demanded we print out the patient's entire medical record to prove how we were lying. Horrible to see the awful side of humans in this pandemic. Story 13. Nurse here. I had COVID-19 and now I'm in rehabilitation because my lungs are at 70% capacity. I was at 40% capacity, and now when I hear someone say that, I have the urge to slap them with a chair. I will need another year until I'm fully recovered. I thank you all for the kind words and the awards. You all are awesome. Story 14. My wife is a nurse and just had to deal with a patient who refused to get tested prior to her surgery. They had to treat her like a COVID-19 patient and needed to charge her for all the added personal protective equipment like gowns and goggles. The issue is that the recovery unit wouldn't take her for observation while she was waking up. So the anesthesiologist needed to stay and monitor her in the room for nearly 3 hours. They are billed at $400 per 15 minutes, and there is no way her insurance is going to cover the extra cost because she signed a document saying she denied a COVID-19 test.